Hello, good morning, doctor.
Hi, good morning.
Hi, dear. Hi, doctor. Good
How are
morning.
you?
All is good. What about you?
All well. I'm just trying to adjust myself.
Okay.
Shall I share the PowerPoint?
Yeah, let's see.
Should you share screen, right? Or this one, Windows?
Windows. Yeah, just try it. You can also press share.
Yeah. I'll take the slide. Okay. You are able to see it?
Yeah, I'm able.
And I
Can you
will,
put it on the slideshow
yeah.
to make it bigger? Okay.
Can you see the slideshow now?
No, not yet.
Yeah. Just wait. No?
No, not yet.
So what should we do? Stop sharing. We will do share screen.
Okay.
Now,
Yeah, now it is okay. Okay, perfect, doctor.
perfect. I hope
Okay.
I finish in 1 hour.
Mhm.
I hope I finish it in 1 hour.
Inshallah. Doctor, we will start by 11, so I will give you a sign.
Okay.
Uh, After people join, I will give you a sign. So you
Okay.
can start by introducing yourself to all of
Okay.
them.
Okay.
And by the end of your session, you can just take any question if they have. You can ask them.
Okay. So roughly what time shall I finish? Like I should finish around 11:40 or 11:50.
11:50 will be okay.
11:50 will be fine. And one more thing I wanted to ask, see, I want this session to be more interactive. So is there anything that we can like, is it okay to ask them to switch on their cameras or something like that?
See, on our previous session, it was not like that, but
Mm.
like they can unmute their self and talk.
Uh, can you repeat?
They can unmute their self and they can talk also. If
Yeah,
they
like
have any
whosoever is
question.
comfortable. Like for
Yeah, yeah,
example, like I want to show some exercise, like I can
yeah,
just go backward and just ask them like with the chair. Now the chair is
yeah,
low. I will try to pull this chair up.
yeah.
I'll try to adjust it.
Okay.
And let's see if they are interested in interacting, it's okay. I'll keep asking them question. Just in the
Yeah.
first or three slides, I want them to interact. Later, I will keep explaining them everything.
Okay, perfect.
Okay.
Okay, doctor.
Okay. Okay. So I'll just switch off the mic now.
Yeah, yeah, no
Yeah.
problem.
Okay. You just let me know when I should begin. Okay.
Okay. Okay.
Okay. Hello, good morning, everybody.
Good morning.
Good morning. So we
Hey,
Good
are
morning.
here.
Morning.
Hello, can you all hear me? Am I audible?
Yeah. Yes, you are audible.
Okay, and you can
Yes.
see the screen, right? Which says work smart.
Yeah.
Okay, great. So let me introduce myself. I am Joshita Pujari and I'm a physiotherapist. I have a master's in musculoskeletal disorders and sports sciences. So today I'm going to give you all a few tips and tricks that will help you to probably work smart and have great ergonomics while you're working, and your productivity will get better. So I want it to be a more interactive session so that it will be very useful for you guys, so that it's not just a lecture, and there is some good takeaway that you can take from whatever knowledge I can share, and that can help you in your daily life. Okay? So let's begin with what exactly is ergonomics according to the Occupational Safety and Health Administration. So ergonomics means designing work environment for workers, which gives them more comfort as per their working area. So every working area will be different. So some work will demand too much, like sitting hours, and some work might demand long standing hours. And while some might be very intensive, where they have to use a lot of technical skill, where they have to do a lot of repetitive movement. So in each area, the setup will be different, and the environment has to be in such a way that if you're doing any particular activity, that supports you to do it for a longer duration, because we are all working for almost 8 hours, 10 hours. Maybe your productivity will be for a stretch about 5 hours, and the 3 hours will be we might get fatigued and tired. But to utilize maximum of your 5 hours to 6 hours, it's very important that our environment supports us. Okay, so by environment there are many factors to it, but we will discuss shortly. Okay, so I want you all to do some brainstorming. I know it's early in the morning, and the weather is really good in Dubai. I don't know about like, I know it's raining, but it feels good after a long time that it's raining and there's good weather. So I need you all to use uh some of your energies to understand what I want to ask from you guys. So I'm going to show you something, and I want you all to brainstorm and tell me what comes to your mind when you see this picture at first. Just quickly, okay? I don't want to spend much time understanding, but I just want to know what is in your mind when you see this picture, when you see this man pushing the trolley. I think you can just put it in your chat, or somebody can speak something. What you'll see when you'll see this picture.
Doctor, can you share me your screen to us?
You cannot see.
We cannot see your screen.
I've been asking you
I
guys,
can
you all
see.
didn't tell me earlier.
No, I can see.
We can
Can
see
you
it.
We
see
can
now?
see.
I can
We
see
can
your
see.
screen.
We can see.
Yes, we can
Okay,
see.
okay, okay.
Okay, now you can see.
Yes, yes, yes.
Perfect. Can somebody tell
Yes, we
what
can see.
what 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 do they see when they see this image?
Doctor, I would describe myself if I have to go for shopping after work, right? That
Yeah.
would be me.
Okay, shopping. Okay, somebody said grab a discount. Oh my God. Okay. Okay, somebody says that picture shows he's in a hurry. Absolutely, he's in a hurry. Grumpy and irritating person. Very nice. Right, strain on his back. Purosha. Tip if okay. He's mad at the trolley, or he's mad at somebody who's asked him to shop. The man is too tall for the cart. Nice. See, these are the kind of answers I'm looking for. Okay, good. Some more. What more else do you see? Okay, the list is big. Okay, that's really funny. That's nice. He's angry. Absolutely. What's happening to his posture? Weather is getting bad, reach home fast. Okay, nice. He's in great tension. His posture is not good. Absolutely. Okay, there is so many. Okay, you're all so active. All had their coffees. Okay. Okay, I know that you guys are active, so got it. Right. Whatever you all said is absolutely right. So what I want you all to focus here on is like, see, whenever you're at work, even then you'll have a lot of things going on in your mind, and there are a lot of tasks, not only at your job but also in your personal life. There are some tasks that you want to achieve, so there are a lot of stress going around in your mind. Whenever something is happening, when you're doing a multitasking, there is also stress onto your body that happens. As you can clearly see, the man consistently starts going into a slouch posture. He's using in a hurry, he's just using one of his hand and one of his leg and trying to rush through the market. So whenever there is additional stress or additional work that goes beyond just working, this is how your body responds to it. That's what I want to focus on. So your body responds to what you are actually feeling. If you're feeling anxious, your muscles are going to feel anxious. If you're going to feel angry, your muscles are going to feel angry. And of course, they are going to adapt to how you are feeling that particular day, right? So this is how it presents. And when he moves forward, he sees that, there is a chance, there is an imbalance. He can lose his track. There can be injuries. That what happens over a period of time. Okay. So when you're more relaxed, when you're more conscious, and when you're more aware, things can be better. Your body will respond to it in a much better way. Your muscles will respond to it in a better way, and your posture eventually will be better. I know it's not absolutely easy to be calm at work at some time. You have, deadlines to reach out to, but it's very important to at least build those awareness. When your mind says that, okay, my muscles are getting stiff, my muscles are getting tight, that's when you have to start being aware. So the first thing Occupational Safety Health Administration is trying to say is that awareness is the most important thing. Once you're aware, that's where you start building things better. Okay, that was my analogy by showing you this image. Okay, moving forward, is everybody with me? Everybody can see the slides?
Yes, you can.
Okay, perfect. So great. Okay, so this is something in your terminologies. If you're into IT work, this is how you feel like whenever your system goes into multiple tabs and multiple things open, the body goes into error the same way. If you're at work, try to keep your productivity at work at that. Finish that task first, because when you are keeping 100 tabs open, even your body tends to shut down. That's what, whatever is man-made. Now, if man is making the computer, if man is making this stuff, it's from the experience of a human body. Human body and everything that you see around are always correlated. So if a technical error can happen there, a technical error can happen even within your body. So it's not about like today I give you the lecture and tomorrow your ergonomics is going to be like on point. No, things don't work like that. It's about how you're going to, or put it in your daily life and adapt it. So before your system turns out to look like this, you need to take control over it. And you will take good control over it. If you know that your computer is going to hang, if you're going to, work like this, you're going to be aware that, okay, no, I cannot do this. My work, my PC is going to hang and my work is going to get delayed. Similarly, such awareness has to be built on daily basis. Changing chairs, changing table, changing your pillow is not going to solve the problem. Trust me, it's not going to solve any of this problem. But what you do on your daily life every single day, even the smallest of change, will turn it into a habit, and that habit will lead to better posture, better. It will keep you away from most of the musculoskeletal disorders that we are going to discuss now. Okay, everybody is with me. Just show me some thumbs up. Okay, great. Okay, so what are the common postural desk issues that you see? I think you all are aware about it. Great. Wow. Thank you, guys. Okay. So, the desk workers generally know that you've heard of like, oh, he looks slouched all the time. He's slouching and working. And if I go and tell him, correct your posture, the answer will be like, I have a lot of work to do. You don't know. I have a lot of work to finish. It's okay. I'll go and rest. It's okay, no problem. 1 day, 2 day, 3 day, over a period of time, it makes a larger difference. The posture starts to slouch, everything starts to become abnormal in your body. It starts to start looking abnormal in your body. There are many people who say, oh, I have this hunchback, I have the neck pain, I have the point is address it first. Why is it coming? Now, when you have addressed it, why is it coming? You of course know my posture is bad. Just by saying the posture is bad, it's not going to solve the problem. You don't have to verbalize that your posture is bad. Your awareness to your body has to be first. It doesn't have to be vocalized. It has to be first vocalized to yourself. Like if I have to tell myself, so I'll say, Shushita, your posture is not right. Correct your posture. Okay, fine. So you breathe better. Whenever you're in a slouch posture, you don't breathe. You don't breathe well. You're just doing a shallow breathing. And then suddenly somebody gives you a call and then you have to rush down. And then you take the stairs. And then you feel that, oh, my endurance is really bad. I really need to start doing cardio. No, you started breathing bad from when you sat on the desk. And you landed up doing thinking that, oh, I have to go to the gym and do cardio. Even sitting right and breathing better can change your pattern of your endurance from like I understand that you want to go and do cardio, but start it from the basic where it actually began. If you still keep on sitting slouch and then go and do cardio in the gym, it's not going to make any difference. That 1 hour of workout is not going to make a difference in a for 8 hours of sitting in the same job and slouching and not breathing better. Okay, so these are the problems that you face on everyday basis: sitting, slouch, forward neck. So you will tell me, okay, see, this is how we have to work. So tell me what have to do about it. So we will discuss that, what you can do about that. Okay, I know everybody tells you this is the problem, this is the problem, but we need to address what is this thing, that how we can make it better on our everyday life. Okay. So many of them will be looking like that. Next time, what you got to do is you see anybody who looks like that in your office, take a picture and send it to them. This is what you have to do. Okay, just send the picture to them. Show them how beautiful they are looking that particular day. Okay, so you don't have to do anything, just send them the picture. Okay. So yeah, when they will see themselves like that, I think you all will make a better ergonomic working environment around you. So that's your first step of awareness. Okay. Now, second is what, so now I'll just put some science to it. What exactly happens when somebody says you're sitting slouched and somebody says that you're having a forward neck? If you have a water bottle at your desk, maybe like a juice bottle or something, which is a bit heavier, not like the small ones like this, I want you to do a task, not right now, maybe later. Just stretch your arm and hold that bottle. Uh, like for just put a timer of 20 minutes, 20 minutes, yeah, and try to hold the bottle in the air. Okay, whenever you are free and doing nothing, just do this task. And you will see that your arm starts hurting. Weird, right? Why does your arm start hurting? It's okay. I mean, you're doing so much of other work. Why does the arm has to, hurt when you're just standing in one, I mean, holding the bottle in one position? So as you see in this picture and image as well, that your chin is constantly against the gravity. We don't realize neck is constantly under gravity. Okay, we are, I mean, we are all walking, we're not flying. So we just forget that sometimes we are blessed with gravity and we are not flying. So the gravity is constantly acting against our chin, and the muscle has to do all those job to pull it back and hold it for such a long period of time. And then comes the neck area. What happens to the neck area? That starts to pull backwards. It's trying to pull you backwards while the neck is trying to pull you forward, because you're just not ready to leave your body. You have to finish the task. It's a deadline. You have to finish it. So this is what happens when you sit straight, like constantly forward head, slouch posture. The gravity is constantly acting, the muscle is constantly pulling. So when you see there is a stack of vertebra columns that are being pulled. Now the muscles are not being seen. I'm just showing you the bone structure. So they kind of press onto each other, and that's where your nerve compression, your disc over a period of time starts to come up. Does it mean that if you do this once or twice, it will happen? No. It's over a period of time, it leads to this. So always remember, whenever you're forward, just hold your chin, put it back. That's all you have to do. Every time you feel, oh, just correct it and you will thank me later. Your neck, you won't have to do that after 3 hours. Oh my God, my neck. Instead, every time you feel your neck is going forward, just push it back. Okay? That's all you have to do. I'm just explaining you what happens. But this is all I expect you to do. Easy peasy. Okay? Now, moving on. These are the muscles, what I was talking about. You see, there are so many muscles that are attached to your neck. There are small muscles, there are big muscles. They do a lot of job for you. Let me tell you that. I know you're doing a certain amount of job, but even the body is constantly doing some job for you, always. So this is what happens when you're extending your back, when you're flexing your back. So does it mean that moving is bad? Like, am I saying that moving is bad? No. You see, if it is kept in one particular position, that's when it's bad. If it is moving like that, it's not bad. You're just giving it some fuel. How your car needs fuel to run. If you keep it stagnant for some time, it doesn't move, right? You need to kickstart it. That's what we say. You have to kickstart the car because it was not functioning. Same thing. You will have to kickstart yourself by taking appointments with the doctor and then all those things. Okay. Now, what exactly happens? Why is it happening? So any kind of repetition of movement which adds force, static, dynamic. Static force is something that you are using. You're typing constantly, you're sitting in one posture. It's called the static. There is some force and dynamic force that is acting on it. And when you're doing it for consistent period of time, that's when the effort comes in. So when you do it for 1 hour, it's okay. When you do it for 4 hours, that's where the effort starts coming in. You have to actually, the body is starting to put effort to maintain you in that posture. Okay. And there can be individual factors as well. Individual factors such as, how stressed you are, what is happening in your everyday lifestyle. Maybe you have other comorbidities that are also playing the role. Also, the work environment. How stressful is your work environment? How much of work are you doing? Like, are you somebody who procrastinates your work, who has been assigned a certain task and you keep delaying it, and then you choose one particular day to sit all day long to finish the work? Try to finish the work a little by little so that pressure is off you. You have to manage time. That's when you will put your body under less stress. It's not about finishing the task. I'm talking about how much stress you will be off your body when you will be able to do smaller tasks at times. Okay. These are the things. That's why these are the indirect things that can directly cause musculoskeletal disorders in your body. Okay. Now, what are the different conditions that we see when a patient comes with ergonomic issues? So it can be strains, it can be sprains. Now, what are strains and what are sprains? Strains generally happens to your muscle. Sprains generally happen to your ligaments. Okay, even ligaments. So ligaments is something like whenever you want to attach bone to bone, whenever there is an attachment of bone to bone, ligaments attach it. Whenever there is an attachment of muscle, the tendon attaches to the bone, and further the tendon is taken over by the muscle. So, whenever we are trying to seal something with sellotape, that is nothing but your ligaments. And the surrounding structures who keep it together is nothing but your muscles. Okay, so whenever the strain is on the muscle is tired, it's the tendon is tired, then it's the ligaments. So it goes in this order. So whenever you are straining any structure in your body, it will follow this kind of pattern, unless and until you have a direct injury. Okay. Then is tendinitis. Tendinitis, as I explained, is nothing but the inflammation of the tendon, okay, which is attachment of the muscle. Here, can you see the red portion in this? This is the biceps. I don't know. I don't have a. I don't know if you can see my cursor. There is this red color of bulge that is present on the bone in the scapula. This particular thing is nothing but, so this particular thing is nothing but your tendon. So when this gets inflamed, it's called the tendinitis. Okay. Then you have low back pain. Of course, everybody has low back pain today in these times. So tenosynovitis is nothing but there is a covering which keeps the tendons, the ligaments in place. When those things get inflamed, it's called tenosynovitis. We have epicondylitis, very commonly known as tennis elbow. We have golfer's elbow, rotator cuff tear, spinal disc, carpal tunnel. Carpal tunnel can happen, when we are using the mouse in this position and we're just, keeping it in one particular position. It can compress against the table and then further lead to carpal tunnel syndrome. Basically, there is a tunnel through which the nerves are passing. You compress it, and then you start having numbness and tingling sensations in your hand. So you will say that, okay, this can happen. So how do we function? Keep moving. Keep moving. Don't keep anything static. Everything has to be moving. Okay. So whenever you're typing as well, you're just using your fingers. Okay, you're constantly doing a repetitive movement. When you're doing take some break. Take some break. Take some break to your hands. You don't have to be, a marathon typer like who has to finish some task and finish it off. It's 5 o'clock. I have to punch out. It's okay. Take some time. Take 15 minutes more. Give yourself rest. You don't have to hurry. Okay, so that you finish the task and then rest together. No, in between rest is more important. So give it some time. Always pace out your work. Tell me something. Do you think this is the ideal way to sit and work, which is in the middle, correct sitting position? Do you think you can sit for 9 hours just straight like that? Can you? I don't think so. We are not robots, right? We are not robots who can keep yourself in an angle and be like, yes, I will finish my work. Yes, I will do the task. It's not possible. So yes, this is the ideal centimeters and this is how you're supposed to have your desk oriented. However, it's not like you always have to measure yourself to have sitting in this angle. This is an angle that you need to sit on, but doesn't mean that you have to sit on this angle for 8 hours straight and you'll have no back pain. It means this is the angle that you have to sit on. However, you have to keep moving your body, keep moving your leg, keep pumping your calf. Movement is very important. So somebody will say, oh, I have bought a standing desk and I'm fine. Now I know that I will have no back pain. No, you will have back pain. You have to switch between all these postures. It's okay. Sometimes you need to bend forward. Sometimes I'm not saying like do this, do this, do this. No, you have to keep moving around this. Sometimes you can sit, sometimes you can stand and take breaks. Keep walking, drink some water so that it can, push you to taking the washroom break more. So not that you do it on purpose and not work, but you need to keep moving. That's the idea of it. Anything that is static will lead to the problems that we discussed earlier. Okay. Now, quick analogy. Let's take a break from all of this. Like what in your terminologies, the IT and investment, all those terminologies. So how I look at it. Posture is basically like your personal app optimization. We optimize our apps, right? Personal. So your posture is something that works for me might not work for you. Something that works for you might not work for me. So find your comfort, what works for you, and stick on to that. But movement is important. Muscles, use it or lose it. The only thing in your body which has been kept and not used, it's a good investment. Start working out. Start, do any form of exercises. Get into any form of. If somebody likes yoga, somebody likes dance, somebody likes resistance training, one workout, one form of exercise is very important. I know you cannot be consistent, but try. It's always good to start new, like every time. Like maybe tomorrow you don't turn out to the gym, maybe you don't go to the gym for 1 week. Go this 8th day, it's okay. Go the 12th day, it's okay. But show up, do some activity. Sitting is like a subscription. You forgot to cancel. So when you start your day at 8 or 9 and then you forget to get up, right? So maybe once we finish this lecture towards this end, I will make you do some activity. I want you to take away that you have to keep moving. That's the most important thing. So do not sit and then forget about it. Keyboard warriors, I just explained. Digital athletes, no, don't do it. Take some break. Very important. It's okay. It's okay if an email reaches 2 minutes late, right? Okay. Monitor heights. It's, you know, billboards, the big, it should be just front of you, right? In front of you, not too up, not too down. Okay. And body algorithm. Body equals to algorithm. You know, the Instagram algorithm that we have, the news algorithm that we have, that's how our body functions. What we put in it, what we do for it is what we will deliver. So if you build stress, you will deliver stress hormones. You know, a lot of cortisol in your body. If you put a lot of cholesterol, you will also give good cholesterol report in your blood test. So what you put in is what you get out. So if you put exercise, if you put movement, if you put these awareness that I gave you, maybe your work life gets very easy. And when you get back home, you often say that, oh, today I'm not really tired. Why? Because you paced out your work well. So maybe your muscles are not feeling that stress. That's the most important thing. Okay. So this is a fun fact that not fun fact actually, but the average person working at a keyboard can perform almost 50,000 to 2 lakh keystrokes a day. And imagine the amount of muscle overuse. And you actually, like even me probably now, I would be nodding my head so many times. We actually nod our head around 300 to 350 times a day. So you just imagine the amount of work your muscle is doing for you than you're doing for your company. It's the truth. Okay. So how do we address it? As I told you, first, identify the posture. Click pictures. Send your friends, identify somebody is having this issue. Okay, you need to correct your posture. First, common intent, persistent neck pain. Okay, somebody is dealing with persistent neck pain and not being able to address it. Please visit a doctor. Please address that problem. Okay, if the problem has just started, it is not that severe. If you want to avoid MRI, CT scan, avoid it. Take some, conservative treatment first. See if it works out for you. Inbuilt your, use some exercises to improvise on your muscle and your quality of life, and then see that if it is required for other additional medications or additional things, you should do it. So if your neck pain or back pain is persistent, seek help. If not, try to improvise your lifestyle so that it doesn't lead to that problem. Okay. And now first, awareness that you have this problem, and then take steps towards it. Now, these are if you have to, okay, so sometimes what happens is that we go for trips and we go on vacations, of course. That's when we come back and then we feel that, oh, I went for vacation and soon as I came back to work, my back pain and my neck pain has started. It's not because of work. Let me tell you. What has happened is over a period of time, maybe you were working for 6 months, 7 months, and when you go for a vacation after 6 months, 7 months, first, you have not exercised or moved your body well. So your muscles, any which ways, are fatigued in some way, okay? And lack of nutrition, like vitamin D deficiency, magnesium deficiency, B12 deficiency. You have not rested well, no exercise, vitamin deficiencies, and then you feel that, okay, finally the day has come, I go on vacation. And then you have to do a lot of, maybe somebody shifting their house, somebody is lifting objects, somebody has a job which has to be lifted like this, or somebody who has to lift heavy luggages. So all these stresses come and show during the vacation. So because you are in vacation, your hormones are like, very happy hormones in the body, you don't feel any pain. And you pick up things in an incorrect way. And because your muscles are fatigued, you develop sudden spasm. And when you come back and start adapting to the same lifestyle, that's when the pain starts to trigger. I'm sure many of them would have experienced this. Okay, so it's very important to maintain the right posture when you're lifting up objects. You should never bend your back directly. Always go into a squatting position. Fix your foot, lift the object, and then transfer the object so that the weight is not at your back, but it is distributed among the muscles of your leg and muscles of your hand. Okay, so if you can use, somebody's help, it's okay. If you need a trolley to push, it's okay. You don't have to be the hero. Sometimes just take help because that can lead you into greater problems because of your lifestyle. If you are at a sitting lifestyle, a sedentary lifestyle where you have not done anything, avoid picking up heavy chairs and heavy luggages. It can suddenly cause your disc to be compressed because of the lifestyle that you have followed. Okay, so these are the things that you can improvise. If you are somebody who's working out and doing things good at daily basis, I think then you can live. There's no problem. Okay, then why this image? I just want to see the ancient people when they didn't have technology. Also, they were using their brain. They were using ways to make their life easy. So ergonomic is work smart, not full of effort. Don't have to be the only champion. Sometimes share your responsibility so that workload is easy. Okay. Now comes the correct one. Okay. So corrective postures, when I say, as I mentioned earlier, see, these are the ideal angles. But are they the ideal way to sleep, ideal way to function? This is the pillow, this is the bed, this the ancient people who never had any of the pillows and any of the bed or any of these things have also survived and have been very stronger. So the idea was they had to move, they didn't have things available so easily. So that's why their body also was very healthy. So in the similar pattern, these are not like you take the image and you keep it right in front of you and just maintain the posture. No, you have to keep moving. You have to address that your movement is the only way you can keep your body functional. Okay, is it good? Understood? Perfect. So I'm going to break some myths and facts for you. Okay, guys. I will tell you some myths and facts. How many of you guys actually exercise? Where are the thumbs up? Where are the thumbs up? Okay, good. 1, 2, 3, 4, 5, 6, 7. All of y'all exercise. Then why do you need this ergonomic lecture? None of you all need the ergonomic lecture. Okay, great. So everybody is exercising. Amazing. Very impressive. Very, very impressive. Okay, so let me tell you, it's so many people have this notion that squatting is not good and lunging is not good for your knee. One of the good exercises that you can actually do is squats and lunges. It will hardly take you 5 minutes before you start your day. You just have to do this, okay, and start your day. And I'll tell you why. And I'm very purposefully put this image because I want you to see this image as many times she does it. Okay, you see her posture, that how she is pushing her pelvis, her back completely behind, and her knee is not crossing the toes. This is the exact right posture. I want you guys to practice your squat if you're practicing. Do not do it in an incorrect way. It will load your knee and cause you knee problem. Okay, then you might say that, there was somebody who took an ergonomic lecture and she told me to squat 5 minutes and I'll be fine. No, you have to make sure that you do it in the right order. So as you see the angle, you have to just try to reach back, like sit backwards. When you sit backwards, why do I ask you to sit backwards? Because that's when you use your hamstring muscle. The hamstring muscle is nothing but the muscles behind your thigh. Okay, we always address the thigh. Oh, the thigh muscle. I want to do some exercise for the thigh. There is a muscle behind the thigh, like, that is called, it's a part of the thigh. It's called the hamstring. It's why I'm asking you to do this exercise is because that's the muscle you're sitting on the whole day. If you are able to even keep it functional, it will not go into tightness. And if it doesn't go into tightness, it will help to maintain your pelvis, which is attached to your spine, in the right order. So it is very important to either stretch or strengthen your hamstring muscle. And this squatting will give you more, more endurance for your sitting. If you're sitting for 2 hours, 3 hours, it will make sure that it doesn't load your spine directly, because your pelvis is the attachment for your spine and for your lower body. So it's very important. So many people say, oh, I'm going to do quads, it's for knees, and the knees will get no. First of all, quads is not a knee exercise. Okay, there are muscles of the knee that are attachments. Okay, of these muscles go and attach to the knee. These muscles go and attach to the knee, the front of the thigh, the back of the thigh. So when you're actually doing the squat, you're not using your knee, you're using your body weight to use those muscles. It is just a point of bending, like it is helping you to move your knee joint. That's it. It's not any exercise. Now coming on to, I want you all to also do this exercise, lunge. Take a picture of it. It's okay. I want you to understand that your back foot has to be on your toes, very important. And your forward leg doesn't have to, it should not move forward. Like, it has to be in the right angle. This is very important, because if it is not maintained in the right angle, both of them, it can cause, direct loading to your knee. So it's very important that you maintain a good angle. Okay. So these are the things that I want you to follow. Keep yourself on toe and keep this right angle maintained. Okay. So these two exercises are very important for you guys to incorporate. Then something very important that I want to discuss is your pelvis. See, as I mentioned that this is your spine and this is your pelvis bone and this is your lower leg. So when you would have seen many people who have this arch in their back. Okay. And there are some people who do not have the arch in the back. So some people will think which is right. So having this arch is not great. Okay. You need to not even have a flat back. These three, initial three are the different kind of postures. You have to have a neutral spine where your pelvis is not too anteriorly tilted or posteriorly tilted. And they will ask me then how do we make it correct? What do we do for it? So what is the ideal way to do for it is, as I mentioned, when you do these exercises, what I mentioned is squat and lunges, they help you to function your hamstring and quadriceps better. So you will eventually form this kind of balanced posture. You can stretch your hamstring also well so that it doesn't go into the shortening position as the picture one. Then there are people who say that there are a lot of discal issues that they see. So in order to reach this disc, it takes a lot of load and lot of weight. When you're doing it for over a longer period of time, that when it gets affected. If it gets affected before that, you would have lifted really very heavy object. Otherwise, in order to reach this, it has to cross this. You are filled with layers and layers and layers of muscles. If you keep all of this functional, you cannot get to this stage for sure. So I want you guys to keep this thing in mind whenever you are um, you know thinking of if one is going to have this postural issues. I don't want you guys to think that okay, this disc, am I having disc, am I having the discal issues? No, it's not that. Directly do not jump to the conclusion of disc. Always remember you have layers and layers of support before that. Okay. Then what are the corrective exercise? That first thing first of all, before doing any exercises, I want you all to please learn this exercise. It's called the posterior tilting. So when I showed you in this picture, the first image shows the anterior tilting. So what we are doing in this exercise is we are trying to push our back. So you see the arch, we are trying to push that arch down and press against the bed. Anything, sleep on, lie down on a flat position and just push your belly downwards and correct this arch and hold this for 5 seconds and probably repeat it for 10 repetitions. Just once a day, 10 repetitions, 5 second hold. I think it's possible if you really want to correct it. What will happen when you do this? So whenever you're sitting the whole day constantly with the arched spine, when you go back and start doing this, it activates your core as well. So the first exercise that I told you before coming to the office, you do your squat, you do your lunges. When you get back after your office, do this. It will help you soften your arch and it will give you a lot of relief. Even if there is some stress over your disc or around it, it will help to relieve it. Then you can do some stretches. These are some stretches. I think we have learned it in our school days. Okay, that you just keep moving. So whenever you feel that okay, I want to take a 5 minutes break. What is that 5 minutes break? The 5 minutes break is moving your spine, rotating your spine, stretching your arms. Why is this exercise important? Because this one will pull your scapular blades. Okay, it will help you stretch your scapular blades. Why? Because your posture has gone in this. So it is definitely tight. So you take it, you rotate it, you will help to stretch it. Then your triceps. Why your triceps? Because you're always in this position, right? On your desk, you're always in this position. So which means your hands, your triceps is doing most of the hanging job. So when you will stretch it, you will give some relief. So you have stretched your triceps, you have stretched your scapula, you have rotated your spine. This will help you at least with your upper body, with your lower spine. Okay. Then is you hold this and you just move forward and stretch your mid back, your whole spine. This exercise is really good. The whole spine will stretch immediately. So this is something that is one more thing that you can incorporate in your everyday life. Okay. This is something for people who suffer with the carpal tunnel, as I said. Take you get a lot of jelly balls or something, not the smiley balls, okay, but the jelly balls, which will just help you just do some grip strengthening. You get a lot of clay with resistance that you can use to just strengthen your grip strengthening. So if you know that you are somebody who does a lot of typing, you can invest in something called as clay putties. You can use that to just relax your wrist and your fingers. See, if you have some condition, please address it. Come see a physiotherapist or a doctor. However, if you want to have, that this has happened to me in past and I should maintain it, then you should utilize these exercises to prevent. These are all prevention exercises. Remember, these are not cure exercise. Every individual is different. I cannot prescribe exercises that will be like the back pain will go, the neck pain will go. Every individual is different. Their conditions or their problems will be different. However, something that you want to do as a prevention, like healthy eating is prevention. Similarly, doing a bit of exercises in your everyday lifestyle is like prevention. Okay. Then amazing stretches. So I want to see, just try this. Okay. Let's try all of us. How many of you all can touch your hand to hand? Like both the hands. Try and tell how many of you guys can do this. So I can tell you, okay, this hand for me is also really difficult, but yeah, I'm able to do it. Okay, so everybody who's able to do it, good job. You're doing good. If you're not able to do it, it's okay. This is a new task. Try every day. And I'm sure you'll reach it. Don't try to reach it in one day just to prove that, oh, you can touch it. No, it means your body is under some kind of stiffness, so you want to break down the stiffness. If you have some shoulder problem already, then don't try to do it. Okay, it's just a small activity I want you to do. So try to keep a check on your body as well. What are the things you could do earlier? What are the things you cannot do? It's not that you cannot do. Practice slowly and moving your neck regularly, as I gave you in the first hint as well. Keep moving your neck. Don't keep it in one stagnant position. Okay, some people wake up in the night, they sleep in abnormal position and wake up at night, in the morning and be like, oh, I have, strained my neck. Because at night, you actually don't know if your muscles have been fatigued and you're only lying in one position for a long period of time, it can cause this sudden spasm of your muscles. Okay. The last one, the seventh one, you see this, it's called the chin retraction. So something that you can do in order to relieve your disc. So somebody who has a habit of keeping your chin back, push it back and just give it a slide, chin tuck. Don't keep doing this, please. You just for prevention. Okay. So yeah, stretching and moving and releasing your muscle, these things you need to incorporate in your. See, these are the only things that will keep you functionally very active throughout the day. Your muscles will not cry for pain and ache if you keep moving. Okay, it's very important to stretch. You won't realize it. Doing it one day will make no difference in your life. But doing it as a part of your routine, as a part of your work, like you go to coffee, like if I don't have my morning coffee, I cannot function. As you have put this in your brain, you have to put it in your brain that if I don't stretch, I cannot function. If I don't do the squat in the morning, I cannot function. Eventually, you'll not be able to function without those. And the best part will be that you'll be able to function way better if you incorporate all of this. So try it. Um, Also, in future, that there are many researches that are going on for the people who are, lifting heavy objects and things like that. Later, AI will be able to detect. So we will know, we'll be able to control, health, safety and hazards issues who because of, safety issues, people have been suffering from extremely bad low back pain, disc pain, because they have to lift heavy objects. I'm sure it's not something that you will be doing in your daily life, but yeah, somebody is working in a factory. But of course, AI is also tracking chairs that will give you reminders that you have to correct your posture, you have to move or move out. I know smartwatch does it, but it will be able to analyze much better that how much your posture is incorrect. Sometimes it's subconscious, like you don't know how you're sitting. That's why take pictures and send your colleagues. Okay. So I would like to conclude it with a few things that I want to personally say that is that your back problems, your neck problems, and things like that will start sometimes showing up when you're probably at the age of retirement. Like till then, you will pull your body so much, and then you'll think that okay, when I retire at this particular age, I will travel, I will do this, I will do that, and your body will not support you with any of this. Is because over such a long period of time you have put your body under so much stress. But this thing can be shortened if you keep moving, if you incorporate exercises, drinking more water or things like that. Like minor changes. What I told you to do is squat, lunges, stretch, move your neck, the correcting your arch exercise. These are certain things, very small things. If you keep doing it, it will be great. See, today I cannot see you all guys. Otherwise, for sure, I would have made each one of you all do the squat and corrected your posture. But I have told you all refer to that image so that you are doing a correct squat, correct lunges. This hardly takes 5 minutes of your time. One more thing that I would like to add is whenever you're sitting on a chair, okay, first thing, how to check that you're in a correct posture. This is one thing that you can do by yourself. Go into complete slouch position, okay, then go into complete extension position. Find anything in between and stay here. This is your ideal position to work. Between complete slouch, complete extension. I hope you all can see me. Complete slouch, complete extension, and in between. This is the ideal posture where you all can do your everyday work. Doesn't mean you have to sit down in this position for 8 hours. Huh? You have to keep moving and adjust yourself to this posture. It should not be slouched. It should not be extended. Don't put a lot of pillows behind and make your muscles just lazy. Okay, any kind of support that you give, like the belt and this and that, it just makes your muscle uh, not functional. Rather, sit, work for a few hours, go, take break. You can keep doing ankle pumps while you're sitting. So calf is your second heart of the body. I'm sure everybody knows the reels have made everybody intelligent now. So it can pump blood as much as heart. So if you keep pumping, it will also help with better circulation. Okay. So any questions now y'all can ask me.
Oh, that was good.
Good. I can see a question. Visiting a chiropractor doctor in case of severe pain is fine or should not do that? Okay, I will share the presentation, no worries. Okay, now when it comes to cryo practitioners, see, they have a different school of thought where they practice. Now, if you have pain, first you should go to a doctor. First, address why is the pain, what is the cause of the pain, and let the doctor decide whether you need to see a cryo practitioner or you need to see a physiotherapist. Okay, so just because you have a certain problem doesn't mean you have to go to or directly to a cryo practitioner. Maybe your problem is not that much. Maybe you just have vitamin D deficiency. You got what I'm saying? Muscle spasm, bone pain, or something can only come because of vitamin deficiency as well. Maybe you're in general very active person. Now, maybe you have a sprain, maybe you have something for a very long period of time. Maybe you need rehabilitation. So doctor will tell you to go to a physiotherapist. And if you have some alignment issues or something to do with which really needs a cryo practitioner, which is in different cases, like there are many severe cases where you need a physio, a cryo practitioner. So let the doctor decide the best for you. Okay. Any other question? Nothing. You are so clear
I
about
think a
everything.
couple of people are raising their hand.
Yes. Can't hear you. Sitting with both legs folded on the chair feels very comfortable while working. Is this advisable, sustainable position for more than 8 hours? Does it create long-term issues? No, absolutely not. Folding your legs and sitting, and if you're comfortable and if it's good, it can be done, no problem. But again, no posture sitting in a consistent period of time is good. No posture. Sitting, standing, walking, flying, nothing. Nothing is good. Everything will have a constant effect on your desk. If you sit in a certain posture which makes you feel comfortable and then you move around, good. All is good. But if you keep on, sitting in that position for 8 hours and you think everything's no, you'll have pain in your ankle, you'll have pain in your knee, you'll have pain in your back, you'll have pain in your neck for sure. Can adequate protein intake be one of the reason why muscle tissue take longer to heal after work or sport? Can inadequate, sorry. And what steps can be taken to improve this? See, according to your body weight, everybody has a certain target of protein that needs to be consumed. Follow that. Okay. Yes, for the recovery of muscle, protein, magnesium, vitamin D, all of this plays a vital role. B12, all of this plays a vital role to keep your muscles, joints, everything healthy. But it's a mixture of all, as I mentioned. If you exercise every single day, but you don't consume your protein or your vitamins, you will still lack energy and still lack recovery. If you are only working and not doing exercise or vitamins or just living a sedentary lifestyle, it will have its own effects. Everything has to be done in a very minimal amount. Like exercise, okay, if you cannot do a full-fledged 1 hour exercise, do 15 minutes of exercise, as I mentioned, do your work, intake protein, intake medications, whatever that is required for your body, it's good. Anything in excess, anything in complete zero will, of course, have its effect. And how will you be sharing the presentation? Could you please post this in the group chat? I will mail the presentation. It's pretty big, so I will mail it. Symptoms of cervical spondylosis. How do I say this? I can tell you what happens in cervical spondylosis, spondylolisthesis, and spondylitis. So the thing is that, like, okay, so the symptoms vary from person to person. When you're having cervical spondylosis or listhesis or lysis, sometimes it can be a camouflage, like maybe your muscles and nerves around it are affected more. So they will give you a more painful muscular pain or tingling sensations and things like that kind of symptoms. can that exact symptom be that, oh, you have cervical spondylosis, or you have listhesis, or you have lysis? No, you have to, speak to your doctor. That's why we have MRIs, that's why we have CT scan, which will help us to diagnose whether you have that particular issue. Okay. Second of all, any symptom that you get, do not conclude it through ChatGPT. ChatGPT is not the place where you get diagnosed. There are so many billion people on this planet Earth. Everybody comes with a different and extremely different symptoms. Of course, pain is only the symptom that is available, but how you get to the point that this particular person has this problem, there is a lot of things that you have to assess, and then come to a diagnosis. That's why I told you, do not conclude yourself with having disc problem or spine. Sometimes it's an accidental finding. You don't even know you have cervical spondylosis unless you do an MRI. Like you have to do an MRI for other reason and you come to know you have cervical spondylosis and there is no symptom. So what do? Should we blame the MRI or should we blame the body? The point is your physical activity is the only thing that determines what is the health of your disc, what is the health of your muscle, what is the health of your body. Only the level of functional activity determines it. Somebody who's functionally inactive is unable to move, unable to, tackle with the pain, extremely excruciating pain. Then we know that this particular person has severe problem. But you're functionally well, you're able to go to work, you're able to do most of the tasks of your daily life, but you still have a little bit of pain. Maybe you don't have any of this. It's just a muscular issue. Oh, I have answered your question. Will correcting a vitamin D deficiency help you relieve low back pain? Not 100%, but it will help you to recover from that pain. It will help your muscles, your disc, or anywhere that there is somewhere recovery needed in your body. It will help to accelerate and have a normal vital function of your body. So it is just, it is not, if you eat this, your back pain will go. No, it is like an adjunct. It's like something that requires your body to function normally. Is there any relation between back pain and HLB 227 positive? Yes, of course. It's because that kind of this HLB 27 positives is basically where it is it's more like an autoimmune, like you get this problem which can lead to spinal disorder. So of course, if you have that positive, you should go and see your doctor and see at what stage are you, but it can be prevented. If you still don't have any back pain, it can be prevented with a lot of exercises. We call it bamboo spine. Sometimes it goes into your ligaments, muscles, and all go into a lot of degenerative process. So very quickly and give rise to bamboo spine. So it's better to take corrective measures with some medications and exercise. It helps to maintain a good lifestyle. Quick advice for me. What kind of advice for knees do you want? If you know that your knee doesn't have enough strength, first build strength before getting into like I should use the stairs. No, you cannot use the stairs if you don't have good enough strength in your knee, because that will further lead to knee joint issues. Okay, so it's very important first to strengthen your knee. How you strengthen your knee? You can do some knee extensions. You can start with holding this position for 10 seconds, like to just straighten up your knee like this, like from a flex position to a straight position, and hold it for 10 seconds, do 10 repetition. You can meet a physio, you can do good rehab for your knee, even if you don't have a pain. Do good rehab for your knee, and then you can start incorporating stair climbing. Sometimes we just dive into doing stair climbing or walking for a long distance. It can directly impact your knee. I recommend daily duration of brisk walking for a 45-year-old individual weighing between 60 to 65, maintaining optimal. Okay, perfect. So you can start with 15 minutes. Check how you're feeling after that. Like if you're not too fatigued, not too if you feel slightly better, your heart rate is not considerably increased, like from directly from 110 to you've gone into 140, 160. If you're able to maintain a good optimal heart rate, then you can add like 30 minutes of walking. Continue that for 1 week, and then slowly add 40 minutes of walking, and that you can do like thrice a week, and other days you can do 30 minutes of walking. So just pace yourself. Start with 15, then go with 30, and then you can maintain 40. Normally, how long it takes to heal a rotator cuff injury minimum period? It depends the extent of injury. If your injury is if you're having just pain, tendonitis around your rotator cuff, it will take anywhere between 3 to 4 weeks to heal. If it is more, it can take 4 to 6 weeks of healing. And if there is a tear or a partial tear, it can take anywhere between 4 to 8 weeks of healing. Are there any specific ways? No, there is no specific exercise for neck cervical spondylosis. It first depends on the severity of your cervical spondylosis. But the exercises that I gave you to move the neck and to correct your posture will definitely help you prevent it. Neck is a very critical joint to directly give exercise for, because it can if the force is too much, if you do anything too much, it can directly affect your it can cause you headaches, it can affect your ligaments, joints, and it can use your accessory breathing muscles. So I wouldn't want to suggest directly a neck exercise, but constant moving of the neck and keeping your shoulder more flexible, doing more exercise for your shoulder will any which ways offload your neck. Okay, all good. Anything else? You all are satisfied with all the answers? How long will I take for low back pain to heal if I take vitamin W? You anywhere between, if you don't have a severe back pain, then you can anywhere between 3 weeks to 5 weeks. You'll be fine. Thank you. My pleasure. My pleasure.
Thank you.
It was nice to have so much of interaction, really. I hope I helped you guys in some way or the other. And I hope you all practice this. It will make a lot of difference. Okay. My pleasure, guys. My pleasure. Y'all can also reach out to us at Fakir Hospital. We are always here to help you guys. If you all have anything, you all can come and see. We are almost like 13 to 14 physiotherapists here. We have amazing orthopedic doctors as well. So if there is anything, you all can always come reach out. We have a lot of medicenters also. If you all are staying far, you all can reach out there. So we are always available for you here. Okay. So I
Thank you.
will.
Thank you.
Okay. Bye-bye.
Thank you.
My pleasure, everyone. Bye.
Thank you. Bye.